65% of vaccine consumption or administration of vaccine happened in our rural COVID vaccination centers.
इसके बाद की जो कहानी है वेव 2 और वेव 3 के बीच की, दैट इज अराउंड द वैक्सीन डिस्ट्रीब्यूशन व्हिच यू हैड काइंड ऑफ मेंशन्ड अर्लियर. तो थोड़ा उसका बताइए, व्हाट वाज द स्केल ऑफ इट? एंड इंडिया हैज बीन रनिंग अ इम्यूनाइजेशन प्रोग्राम फॉर किड्स एंड फॉर women, but itna adult scale पे it was not there. So how much of our earlier things that we had helped us that experience, and how much it was actually fresh ramp up of kind of centers and all that? So what is the cold storage? थोड़ा सा vaccine distribution के बारे में बताइए.
You see, what I told you is that we did not have a pan-national adult vaccination program. So this was the first such experience. And if we look at the figures, that will give one some idea of the sheer scale. So we had 3 lakh COVID vaccination centers across the country, including private COVID vaccination centers. We had 10 lakh trained personnel, out of which almost 7 lakh were vaccinators. Each vaccination team had 5 people, including that trained vaccinator, because that vaccinator was supposed to upload data on real-time basis on CoWIN, the digital platform. We had 28,000 cold chain points across the country where vaccine could be stored. We had 62 delivery points where the manufacturer would deliver the vaccine. And this was happening for the first time.
So when such was delivered at the 62 locations, from there the handover...
The state governments will then take it to 28,000 cold chain points.
This point from there...
And from there it will be taken to the COVID vaccination centers. So this is the number which will give you the spread. And given the different geography of our country, you had vaccination teams going on elephant back in Assam, on camel back in Rajasthan, on boats in Bihar, and they in fact painted those boats and they called them Nauka par Tika.
Acha.
Yeah, Tike wali now. So we have those photographs.
So then the actual vaccination will happen on the boat.
Because you have in Bihar certain low-lying areas, they are called the Diara, where you can navigate only by boat. Similarly, you have riverine islands in Assam. So how do you go there? How do you vaccinate people? We also have photographs of our vaccinators going on a dozer. A dozer has a big bucket in front. So you have these young ladies, the vaccinators, who are sitting on that bucket, and these pictures are from Himachal. Because there was no other way of reaching those villages. Although those villages had very little habitation, maybe 3 houses, 4 houses, but they had to be covered. Even helicopters were used. In Mizoram,
this was part of Har Ghar Dastak, right? That was the...
No.
This is before.
That came much later. Similarly, in Mizoram and Manipur, ICMR did a drone delivery of vaccines. So all conceivable means of transportation were used. Let me tell you something very interesting.
So the examples that you're giving, this is to get the vaccines to the vaccine centers, the vaccination
to the
centers?
COVID vaccination center.
To the COVID vaccination center.
Yes.
Achha, this is not still yet in the phase when you are making sure this 100% saturation and therefore you're going door to door. This is not that. This is COVID vaccination center.
That came much later.
COVID vaccination centers ke liye bhi सारा different.
Yes. 3 lakh centers. Not all of them are in areas which are easily accessible. And let me tell you something interesting. there was this debate also कि शहरों में वैक्सीन ज़्यादा लग रही है कि गांवों में लग रही है. And our data revealed towards the end of the third wave that 65% of vaccine consumption or administration of vaccine happened in our rural COVID vaccination centers. So, enormous enterprise. Our 3 lakh auxiliary nurse midwives, they played an important role. ANMs. We also had 10,70,000 ASHAs, accredited social health activists. These are these local village ladies who do other health services also.
Or take care of the
So they were
pregnant women.
repurposed. So they were repurposed so that they could do a role in COVID vaccination also. In addition, we had block level adverse COVID reaction committees consisting entirely of doctors, then district level adverse reaction committees, then state level, and there was a national level. And all their reports were duly vetted, analyzed, and the final report of the national committee on AEFI, adverse events following immunization, they were put in public domain. This is another very interesting story.